Hey everyone, welcome back to Service Dog Rosie. I'm Katie. Rosie's over there in the kitchen just wandering around. Okay, so this video is all about, this is going to be backwards, lupus awareness. May is Lupus Awareness Month. If you have lupus, if you know somebody who has lupus, or if someone has passed away with lupus, this video is just going to give you a little insight to what it's like living with lupus from a patient's perspective. I was diagnosed with lupus in 2014, February 1st, I believe, of 2014. Over here I have my diagnosis sheet, so eventually I can go over all of my diagnoses with you, but that's for a different video. Some of these are comorbid, so I will mention them in this video. Over here I have my notepad, my tablet, because I made some notes, and of course some lab results, but I'm not going to go through those because that's going to waste your time. And who wants to look at lab results? So, okay, when I was initially diagnosed, I was told, if you see me drinking water, it's because I'm extremely dry throat. I apologize. Alright, so when I was diagnosed, it was a long road. They suspect I had lupus starting at around age 14, because so many symptoms lined up, it made sense. But as you know, a lot of doctors rely on the anti-nuclear antibody test, or ANA, and the anti-dsDNA test. Well, mine initially came up positive. It was pretty high. So we started me on Plaquenil and prednisone and folic acid, which are pretty much a standard, starter on this. Also, initially I had Crohn's when I was 17. So I was diagnosed when I was 24 with lupus officially. Now I'm 28. So I've had it 4 years, a little over 4 years, 4 years and 2 months. But being on Crohn's, medications like Imuran, Humira, some of those help lupus, but some of them hurt. And I'll go into medications in a different video, but this, I just want to talk about the signs and symptoms, how it affects me on a daily life, and I'm trying to keep this video under 15 minutes. But, okay. And I'll try to insert some pictures to show you the physical symptoms, because lupus is pretty much an invisible illness. And it's different for every lupus warrior out there. Some struggle with weight. I apologize if there's beeping in the background. My Dexcom right here for my blood sugar reads low, reads high. Okay, so to get started. There you go. Dexcom went off. Alright. So I got extremely swollen joints, and which makes me somewhat different, my rheumatologist said, from the other typical lupus patients or mixed connective tissue disorder patients. It's an umbrella term if you have multiple. For lupus specifically, everything joint-wise affects me on the left side, majority of the time. All of my pain is generally in my wrist, my fingers, my hip, and my knee, and my ankle. There's also comorbid conditions that play into that pain, but another thing was extremely bad migraines, like extremely bad, and photosensitivity. Photosensitivity is not specific to lupus, but it can be. So when I get my migraines or my headaches related to lupus, all bets are off. I have audio sensitivity, meaning sound, photosensitivity from the light. Even without headaches, I get photosensitivity. When I'm out in the sun, I get random rashes. My rheumatologist recommended UVA clothing. The problem is, if you're on a limited budget like me, it is dang near impossible to get those UVA, UV clothing under $50. And I personally am on disability. I used to work in the healthcare field as a nurse aide, and I went to nursing school, and everything was taken away from me. I'll go into that another day. But we just got to keep going, you know. I would have swelling. I have swelling in my hands. It's hard to tell because it's on camera, but my joints are swollen. I'm extremely hypermobile. That's another condition. Another major one was severe anemia. Even though I was eating a lot of red meat, good food, my diet is not the best. I'm not gonna lie. I am not perfect. I eat a lot of junk food. But on the other hand, my anemia still was terrible. 7.1. I need a blood transfusion. Let's get some Venifer. Let's get some Injectifer, which are all iron supplements. I've intravenous supplements that they do. I've had a port here, portacath, and a portacath over here. Unfortunately, my body has a very weak immune system, so they had to take them out, thinking they were infected. The first one was, the second one was not infected, which I regret signing for that surgery. But there was a reason for that, and I don't know what the reasoning was, but, you know. I have a lot of costochondritis, whatever it's called. I have a lot of pain in my ribs, and I get the butterfly-shaped rash on my face, which I currently don't have that bad, but I will insert a picture somewhere in this video, maybe in the front or the end, the beginning of the end, showing you my butterfly rash. And honestly, only 50%, they say 50% of positive lupus patients that are diagnosed have the butterfly rash. So, and they say that some statistics say 95% people have positive ANAs, but as we all know, well, most of us know, that ANAs fluctuate like crazy. Mine has been negative for, I don't know why I'm screaming. Mine's been negative for like, I want to say, sorry, hopefully you can hear me better. I want to say mine has been negative for 2 or 3 years. So, but I have other antibodies related to lupus. Autoantibodies. Hair loss. Bald spots on the scalp right there. It's not very evident, but my hair has fallen out and I have a bunch of baby things like this. A lot of people have baby things, but it's excessive and annoying, and the plaques on my head are painful. Yes, we've looked into psoriasis. It's not psoriasis. Okay, a lot of us have a comorbid condition called antiphospholipid syndrome with lupus. At first in history, it was thought that it was only in people with lupus, specifically lupus anticoagulant. The disorder is called antiphospholipid syndrome. There's 3 types. I believe there's anti-glycoprotein and lupus anticoagulant. I don't know the other one. Please comment below if you know the other one. Offhand, I can't think right now. It's late. But I have lupus anticoagulant, which is a blood clotting disorder, autoimmune, that your body makes proteins that attack, I believe, the red blood cells and cause them to stick together and clot. And I personally have had so many negative repercussions from my blood clotting disorder. This was discovered before I had lupus, back in 2014 as well. December of 13, I apologize. I lost complete peripheral vision in my right eye. And then it progressed to my left eye over a couple years. And it started in this corner and then migrated down. So I have absolutely no peripheral vision. Fortunately, I'm currently still able to drive. I do have modifications that I turn all the way around when changing lanes, when turning. Yes, it's extremely scary. So right now I'm on Lovenox twice a day for that. Raynaud's phenomenon. I will insert a picture of that if I remember, but basically the top of my hands turn white. I have reverse Raynaud's. Typically everyone's turns. Mine's just different. My whole body's completely rebel. So I have Raynaud's where my fingers will turn white, not red, but white, and everything else turns purple in my hand. Relating to the lupus, I have lung involvement from interstitial lung disease, and I have other autoimmune conditions, about, I would say 5 more associated with lupus. And then I will talk about them in a different video. But those are my main issues with lupus. And another mild one, I get mouth sores and, sorry I'm not looking at the cameras over here somewhere, but I'm staring at the screen. I have mouth sores. Most people with lupus, or the clinical notes of the rheumatology notes that are, not notes, cat chasing the dog, dog chasing the cat. The scholar articles of lupus say mouth sores are not, Rosie, sorry guys, are not painful. Well, I completely beg to differ. Now, whether those mouth sores are related to my Crohn's or lupus, I'm quite a mystery to my doctors. But I'm pretty sure they're related to the lupus. So, I talked about anemia, talked about blood clotting disorder. Let's see if I'm missing anything. Lupus also is called the great imitator. I forgot to mention that. Rosie. She's itching because she has bad allergies. Okay, lupus is the great imitator. This is just the last note I have. Okay, one more. I lied. Dexcom. Sorry, I can't help it. Okay. Pleuritic pain or lung pain. That is a daily thing for me. I get extremely short of breath, walking the shortest distances. Sitting here talking to you, I'm fine. But I get a lot of pleuritic pain, costochondritis, which is inflammation. That's the word I was looking for earlier. Costochondritis, which is inflammation in between your ribs, causing them to rub together and subsequently causing pain. All right. So the last part of the video, guys, is lupus is a great imitator. I personally know somebody very close to me who has multiple sclerosis. When we talk, especially because I have central nervous system involvement, how that affects me is I'm very clumsy, I drop things, I lose feeling in my hands, in my feet, they go numb, I can't remember things, the room starts spinning, there's just a lot of other things. But it's the great imitator. They thought I had multiple sclerosis first, but I didn't have any lesions on my brain. Other than on my pineal gland. I had a pineocytoma. Have one. Okay, so some, I'm looking at my notes, sorry. Some things that, symptoms are often like multiple sclerosis, which is an autoimmune condition, I believe. Correct me if I'm wrong. It's an autoimmune condition that affects the brain and spinal cord and central nervous system. Another thing, it mimics a lot of bone, lung, and heart conditions. Don't know specifically, but it also mimics rheumatoid arthritis, blood clotting disorders, fibromyalgia. You guys who think you have fibromyalgia, keep digging. Fibromyalgia is a very real disease, but keep digging, because if you have fibromyalgia, you probably have another autoimmune condition with it. You may be called crazy. I don't know. I've been called crazy so many times. I'm looking for excuses. I want attention, which we all know. My doctors know is bullcrap. So, and it will, if they put something on your hospital record, like, oh, she's crazy, you know, or she's trying to hurt herself. It can affect people, how they see you, how they perceive you, and then you're screwed. Tell me, comment below if they've said, oh, you're crazy, you must be doing this yourself, you know, because that happened to me. I'm not going to sit here and lie. And yes, it hurts. It made me cry the hell. Excuse my language. But it made me cry. But I'm going to get back up and keep going, because I know these diagnoses are accurate, you know? And the problem is I've had family members say, you know, oh, you need to go off all your medications. Multiple doctors saying that. You know what? Ultimately, it's my body. I've done that before in the hospital, and it got worse. So, thank you guys for tuning in to this Lupus Awareness Month and how it's affected me in my life. And, come here, Rosie. Up. There's Rosie. Come here. Up. 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 Say goodbye to your friends. Say goodbye to your friends. Thank you guys for tuning in. We love you guys, and I'll do an update on Rosie shortly. Bye. Hey guys, this is a major surgery. I had to remove lupus nodules on my left thigh. This is a standard IV pole with a pain pump and a wound vac and all the medications I need. I must get a PICC line for harsh antibiotics because I'm on a lot of them in the hospital when I'm sick. It's another pick of a PICC line and full of blood. This is my thigh with the infection on it. I didn't want to give you too graphic of a photo, so this is just a mild one. Occasionally I'll need an NG tube or an NJ tube because I can't get the proper nutrition. Here you can see the swelling in my hands from a lupus flare and the steroids, and just another fine PICC line example on my arm. Here's me and my dog at Christmas right after I got out of the hospital, and then I went right back in afterwards. This may seem a little gross, but this is what happens when you get a thrush infection and lupus affects your teeth. Here's another infection in my ankle with the lupus nodules, and it was and of course, another PICC line. This is an x-ray showing the PICC line in place, going to my heart, but you can't see it.